It's September 1st. It's launch day. Jump and Boom presenting Jump In for Women's Heart Health. I'm Lianne Laing, the new Executive Director of the University of Ottawa Heart Institute Foundation, and we are so excited about bringing you this brand new initiative. It entails 30 minutes of physical activity for 30 days over the month of September. You can be creative. Walking the dog, going for a run, a walk with an old friend, a hike maybe, a bike ride, a paddle, a canoe. The opportunities are endless, and we have some great suggestions available for you on our website with great partners, people. Also, we've got some amazing information and stories right now that will help inspire you to take part.
It's a dream of mine, really, to have the awareness go across the country, because I feel that you sort of become a sisterhood in that it's not just about what you're raising funds for or what you're trying to create awareness for, but it's also a great camaraderie that develops out of something that's bigger than yourself. It creates an awareness, just like you would do training for mindfulness or anything like that, that it's a top of mind thing that through me being committed to create awareness and raise funds for the Heart Institute Foundation and the Women's Heart Health Center, it focuses me on it, and it makes me aware that I have to get out and do something.
Cardiovascular diseases or heart diseases are the #1 killers of women in the world. And for so many decades, women have suffered, perhaps as a result of this lack of awareness. So it's very important that we bring it to the forefront and everybody knows about this, because the important point is that 80% of all of these diseases can be prevented. So we can actually spread this message, get as many women and men aware of this, and doing all the right things to prevent cardiovascular disease, we're going to set everybody in the right foot.
Okay, why is it different though? Should women be more aware of certain aspects or certain symptoms than the men?
I think awareness is good for both sexes because this disease can affect both sexes, but women should know that what they have seen on TV, in the movies, reading magazines or books may not be exactly how heart disease manifests for them. So there are some symptoms that are a little bit different. Sometimes what we call the Hollywood heart attack, which is the classic example of that man clutching the chest and just looking very distressed. That may not be exactly how women perceive, for example, a heart attack. Certainly most women with a heart attack will have chest pain too, but it may not be just that one that you saw on TV. The chest pain may be more like a sensation of discomfort or a sharp feeling. It may be sometimes just in the throat or just in the arms, or it may manifest mostly as a feeling of indigestion. This is a word that I hear all the time from my patients. A lot of women sometimes have a lot of shortness of breath, palpitations, and other symptoms together with the chest pain that sometimes kind of confuses the picture a little bit for the women and for the clinician. So a few things to think about how it may manifest differently, but in my experience as a cardiologist, and I've seen of course so many men and women with heart disease and heart attacks in my life, I feel like even though women may not have the textbook or the movie kind of symptoms, they know something's up. They know that there's something wrong. They know that this indigestion they're feeling may not be true indigestion. They use the word indigestion because it's the best word sometimes they can use to describe it, but deep inside they know there's something different. So if there's something that is concerning a woman, we definitely encourage them to present to a hospital, call 911, and don't delay. When the Canadian Women's Heart Health Center was launched several years ago, it was really a first of its kind to really prioritize women's heart health from all of the fronts, from educational fronts, awareness, advocacy, research, and clinical care. And the entire center is funded based on support from our community and donor dollars. We have been able to launch such innovative programs that have helped so many women in our region and beyond now in the virtual world. And for us to be able to continue offering these programs, expand them, and really truly change the heart health of women in Canada, we certainly need to have continued support.
We can make an impact.
Absolutely.
Well, I think I like to think anyways that naively that when you look at me, you don't see that. Like you don't expect me to have that type of story, like mom, 3 kids, busy wife, whatever. But yeah, it was about 4 years ago, and unfortunately I suffered a very severe heart attack. due to a spontaneous coronary artery dissection, a SCAD, typically associated with women who have recently given birth in their postpartum period, and that was me. And thankfully, I came through it okay. So all these years later, I'm definitely, hopefully, back to normal and living life the best I can.
This wasn't something that you had been educated on or even knew really existed prior to this experience.
No, I was so, I'm honestly, I'm ashamed now because I really try to advocate for this, try to get people to understand that it can happen to anyone. But I was that person who was lying on the floor in a public washroom thinking that I was allergic to pickles or suffering from mastitis, and just belittling everyone around me who was telling me I should be going and calling for 911, and I didn't want to bother anyone, I didn't want to make a scene. And now I look back and I'm like, thank goodness that someone had the foresight to understand what was happening to me when I couldn't. Now it's black and white, now I get it. Like, if it happens again, I'll do what I need to do. But at the time, no clue.
And getting friends, family, everyone involved, it's a 30-day commitment.
Yes, I've got everyone on board, so we're ready to go. Let's do it.
So as you can see, this initiative is critical for women all across our country, and especially here in Ottawa, home to the Canadian Women's Heart Health Centre. And it's because of you, our generous donors, our community supporters, our participants, we're all being involved in this initiative. And of course, for the corporate support, because we have companies like CIBC Wood Gundy, Gallant McDonald, and restaurants like Giovanni's who are matching your donations all through the month of September. So how to get involved? It's pretty easy. Head to jumpinnow.ca.